Hello everyone and welcome back to the Mathari National Teaching and Referral Hospital digital space. Today we have a very important guest and I'll tell you more about him, but today we want to have a conversation about maternal mental health with a specific focus on postpartum depression. I am Dr. Vundi. I'm a consultant psychiatrist at Mathari Hospital and I will be having this conversation today. And to my left is a very wonderful friend that I met recently, who I want to give the chance to introduce himself. Karibu sana.
Thank you so much for having me, and I cherish the platform to be able to echo the sounds of many who are going through postpartum depression. So my name is Ben Hage Onyango, and I'm a cyclist, so I enjoy cycling. And today I'm here with a focus on appreciating mental health. And so I am a sociologist by training. I've interacted in my work experience in the space of public health, and that interaction has led me to have something innate in me to be able to just keep the conversation going beyond just a general engagement, but focusing on health promotion, going out to figure out what are the other ways of doing this. So I use bicycles as a tool to basically engage. So some of the things that has allowed me to be able to reach out to more people is using the bicycle, for example, to cycle through 9 countries and echoing the voices of people who are using the roads. So road safety, because you know one of the public health issues is accidents on the road, and more so for people who are cycling or motorbike, etc. So going into such journeys allow people to appreciate that, hey, there's a lot that we could learn through the process, and not only learning, but seeing it from my own eye or from my own focus, so that people can also get involved. I've done many other things. One of those is last year, for example, in 2025, I went out and cycled over 12,000 kilometers from Kenya all the way to South Africa and back.
Wow.
Trying to share about Turner syndrome, which is a genetic condition that affects women and girls who miss an X chromosome. So that is basically who I am. I have a lot to share, and I'm happy to be here. Thank you so much for having me, Dr. Vundi.
Wow, that's amazing. And the fact that you've come to visit us here at Mathari, I suspect that your new advocacy journey has something to do with maternal mental health?
Yes, it has.
Tell us a little bit about that.
Yeah, during my cycling, I was about 128 days, October, that was early October. So I checked my phone and I saw a message that was quite unique. So when I read through the message, it was like, hey, we've lost Diana. And so like, couldn't figure out what had happened. I was quite fatigued during the day. I think I was having eye issues. So I thought, let me just rest. So I was in Tanzania coming back. Later in the evening, now the details were shared with me. And so we lost Diana out of postpartum depression. She left a very young baby, barely a month old. And so when I, through that night, when I was thinking around what awareness will look like, I said in 2026, then I'll go into and create awareness of mental health, and particularly postpartum depression, because from the family point of view and for myself is not, we don't want any other new mother to go through the same. Why not echo the information required, the services that are available, the social spaces where one is able to pretty much have a conversation to lessen the burden of feeling isolated and so on. And so I'm here today to be able to just be that voice showing the steps to women and families and even healthcare workers, how a journey could actually support many other people, because delivery will always happen. Even today, there are many people who are giving birth. So if you look at the numbers, and I know the statistics, for example, the teenage and below, when you talk about postpartum depression, you're looking at 43% up to 48%. That is almost For every 2 births, one might, or most
Yes.
likely, will undergo PPD. So that's why I'm here. Mathari is a national facility, and it incorporates mental health. And so
Yes.
coming here allows me to appreciate
Thank
how does
you.
it look like to be supported
Yes.
through the process of maternal mental health, and
All right.
specifically,
First
yes.
of all, let me just say I'm so sorry for the loss of Diana. Of course, we had talked before and you had told me the story. For those who are watching and are not fully understanding what we are talking about when we say postpartum depression, let me bring it back home. Postpartum depression is a mental condition that affects women who have just given birth. The prevalence is about 10 to 20%. In Kenya, it's closer to 15%. And what that means is after a woman gives birth, because of the hormones fluctuating, it causes a condition where a woman gets sad. So there's issues with the mood. Other symptoms could be irritability, anger, lack of sleep, although we know that at that time really you can't sleep, but it means that some of these women can go for days without sleeping. Now, there can be excessive feelings towards the baby where you're not feeling attached to the baby, you're not feeling like you're bonding to the baby. On a very extreme end, we do have postpartum psychosis, whereby the woman completely loses touch with reality. And these some of the consequences of postpartum psychosis include women harming themselves, so taking their own lives, dying by suicide, or even harming the baby, what we call infanticide. So postpartum depression, having listened to the signs and symptoms, you might be wondering, maybe you have a wife who is pregnant, you have a sister, and you're wondering, how do I tell that she's not okay, and what do I do? So from the symptoms that I've given, if there's any change in 3 parameters that from thoughts, feelings, and behaviors. So if there are any changes of a woman during she's given birth and you're observing that her thoughts, feelings, and behaviors have changed, please reach out to a mental health professional. We have psychologists, but preferably we aim to start with a psychiatrist. Okay, so if you see that her thoughts are, we start with thoughts, her thoughts are sad. She's always thinking thoughts that my baby is going to die, I'm not a good mother, I'm worthless. So if you're noticing her thought patterns are negative towards herself, towards the baby, that's a sign. Moving to feelings, if she's talking about sadness, if she's talking about excessive worrying, feelings can even be anxiety, or feelings like the baby is irritating her, take this baby away from me. So those are some of the symptoms. Behaviors are the last parameter. Remember, we said thoughts, feelings, behaviors. If you notice strange behaviors, right, that she's withdrawing herself, she's isolating herself, she doesn't want any visitors, she's refusing to shower, odd behaviors, throwing things, banging things, then you know that this person needs help. Bringing this back to you, Ben, I think one of the things that we can't, finish this conversation without talking about is stigma. And I believe the whole point of advocacy is to dismantle stigma. Can we talk about what you have seen when in your advocacy journey when it comes to maternal mental health?
Yeah, thanks. One of the hashtag, I know in the space of hashtag, one of the hashtag is basically cycling to kick postpartum depression stigma, because it's real. I was having a conversation with someone who has a lived experience, and one of the stigma that came to her was just feeling she's not part of the family. And so isolation became a reality to her, and she created what we call a dark room. So wherever anything happens to her, she'll be looking forward to going to this dark room. I'm reflecting back to what she said. Could it be different? Honestly, She was aware about it, but the environment kept on bringing the same issues. Why did you decide to go try and commit suicide? Why did
These are now
you? So
questions from...
the questions now she's being asked. Looking at stigma from what I call the nuclear family is number one, because she got pregnant when she was a teenager, and so it was not an expectation. And just as mentioned earlier, if you look at new mothers and PPD, most of it in terms of percentage is way high among themselves.
Yes.
And the stigmatization starts from there. Secondly, when talking about advocacy with the focus of the community, most people are actually not aware about it. They say, no, si ule mwanamke ni hivyo ndio anafanya. So it's generalization. It's not coming to understand, for example, could there be something wrong? Was this the same person you're seeing? Behaviors you've shared? Is there a pattern that has changed? And so, as an advocate, for me, it's trying to get how do we support the community members to recognize certain behaviors or certain patterns that could allow community members, our healthcare providers, to even go a step ahead and support them further. Back to the story of the lived experience, she mentioned that once I gave birth, I had a tear. The tear was never done immediately. It was done the following morning after childbirth. So pain became part of the whole thing. So whenever she felt pain in her environment, she felt like, you people don't understand me. And so when she talked, the rest of the community will be like, but that's your own problem. So that kind of feeling also brings that feeling of I'm not part of.
I think
it's not the easiest.
It's not the easiest. As we talk more about stigma and the advocacy that Ben is doing, I think, Ben, I need to shine a light on what you're doing a bit more, because people don't know that you have cycled all the way from Mombasa. You started 4 days ago.
Yes.
And tell us a bit more of your journey. Where are you planning to go? And as you're going to all these places, what are you actually doing? Are you interacting with the community? Are you meeting other doctors? Tell us a bit more of your journey.
Yeah, thanks. So my journey is appreciating the context where Diana lived, which is Kenya. And so I decided I'll do cycling within the country. So I'm cycling across 12 counties in Kenya. And within the 12 counties, I'm doing very different things. Of course, having courtesy visits, of course, health is devolved at the county level. Then away from that, now visiting specific entities. So I started off in Mombasa, where I was flagged off by the public health and prevention director, Dr. Salma Swale.
I know Salma.
And then, of course, with her counterpart in the mental health space. So they gave me a feel of, for example, how they're working to empower the community health promoters to have, to some extent, understand the mental health. So that they're able to identify them at the community level and have a linkage with their health facilities. So that's where they are at. And they are trained, if I'm having the number right, about 10 of them out of the many CHP that they have. And so that is the strategy they're using, so that they're able to identify some of the cases, including those from postpartum depression. So it's a learning lesson as I'm doing this. So that is what I learned from Mombasa through the Mombasa County. Then when also still in Mombasa, I also visited Chiromo Health Group, which is also a health facility that supports mental health or wellness. And in there I was asking the question, what is PPD from your perspective? And the facility, what are you doing? And hearing the expert, the psychiatrist and the psychologist speaking, it gets me to understand how much we have in terms of support. The question now is, how do we link people in? So as I'm doing this, I'm sharing about this. You are a listener out there. You get to see and understand there's so many places you can actually get support. Sometimes The example I gave you last time.
Yeah.
I mean, I'm 40 years. It was my first time visiting Mathari.
Yes.
Getting into the gate.
Right.
Now
right.
here I am again.
Yes.
I'm beginning to appreciate that,
Yes.
hey, it's a facility that supports general treatment,
Right.
including mental health.
That question that you asked the team at Chiromo, I'm going to attempt to answer it because I've really taken it as a challenge. As Mathari, what is our view about maternal mental health and what are we doing about it? In fact, that might be my challenge for the next year. But I can say that we take it extremely seriously and it's a top priority. Whenever we have a mother who is not doing well, and she has just given birth and she presents either at the outpatient or at the clinic, she receives top priority. There is also a lot of research that is going on within Mathari, which I'm very, very involved in terms of to see the gaps and how those gaps can be filled.
Yeah. There are many gaps surrounding maternal mental health, being one of the areas in mental health, and mental health itself in general. There's a lot of gaps and a lot of issues going on in the community. But I'll pick up from what Ben mentioned when you were having a conversation with him in terms of awareness. Yeah, so awareness is one of the biggest gaps, even for the mothers themselves, knowing that what am I going through? Is this normal? What am I experiencing when I've experienced the birth and now they are going through depression? Yeah. Sometimes there's what is also termed as a postpartum blues. So people sometimes just imagine it's just blues. It's just women go through this. They experience this after birth. And sometimes, as we were saying earlier, it can get normalized and the mother doesn't know that she's actually going through a condition that is treatable and can be managed. Yes. So that is one of the first gaps that I usually notice, is that the mother herself may not be aware of what she's going through. Yes. That is actually a major problem that can get complicated, as you said earlier, and even go into psychosis and go into even fatal outcomes. And even the family, the people around that mother are not aware that this lady is going through a lot. Sometimes they feel like they are exaggerating. Other mothers have given birth and they have gone through bigger problems. So there's a big problem with awareness, people understanding that postpartum depression is a big thing. It's an actual condition that women go through after giving birth, and it's something that needs to be addressed and can be treated. So that's one of the major gaps in terms of awareness. The second gap is access to services and being able to get treatment. As you've said, it's a condition, as you highlighted, it's a mental illness and people can get treated. So people may not, first of all, be aware that it's something that they can come to hospital to get treated. Right. So that is the first gap in access. They are not able to know that they can get treated. And when they get to many facilities, so it's a condition, as you said, that is treated by psychiatrists and psychologists. So in many parts of the country, we may not have enough psychiatrists, we may not have enough psychologists where these mothers can go to and get treated. But that gap, at least of late, has been getting filled up. There are many psychiatrists getting trained and many are going back to the counties. So you might feel like you may not know, but some county near you, a county referral hospital near you should be having a psychiatrist and should be having a psychologist. Just walk in and ask the accident and emergency or the reception. You might get a psychiatrist, and that is the first stop where a mother who has experienced or is experiencing postpartum depression can get services from. So the next gap that I talked about is access. Then the next gap is getting the right treatment or getting the right environment for treating this mother. So you find even when they're in a county referral hospital or even in a facility like ours where this is a national mental health hospital, if they come here for treatment and they get admitted, then we are not able to give some services like a baby wellness area where the mother to baby unit. Exactly. So sometimes the mothers have to leave their babies back at home, or the relatives have to stay with a 1-month-old baby, 2-month-old baby, and now the nutritional benefits for that child and even the mother's benefits being with their own baby. Well, they are getting admitted and they are getting treated for the postpartum depression. We are adding more stress because they are away from their baby. There we go. So the environment, hospital environments may have some gaps where we need to rethink. We need to see how best we can make sure that when the mother is getting treated for the postpartum depression, we can make the environment conducive enough for the mother and the baby.
In fact, you've just answered my next question. I think that's one of the answers. I was going to ask, what are some of the suggestions that you can make to help bring close these gaps when
Yes.
it comes to maternal mental health in Kenya. So I'm guessing recommending mother-baby units
Yes.
would be one of the ways that you'd
Yes.
recommend we
Yes.
close these gaps. What are
Yes.
some of the other suggestions that
Yeah,
you have?
one of the ways, as you've said, is making the environment conducive
Yes.
and ensuring that the mother and the baby have dignity in the process of recovery.
Yes.
So that, for instance, maybe that's one of the challenges that we can take as Mathari, that we can
There we
start
go.
thinking of having a dormitory or a place where the babies can be available for the mothers as they are
Yes.
being treated. In other ways that we can fill in these gaps, as I've already talked about, we talked about the gap for awareness. That calls for training. That calls for a lot of teaching, a lot of awareness that Ben Hagai is doing. I've been commending him and telling him he's doing a great job.
Yeah.
He's going out for us as we're sitting back here in the hospitals to treat the patients. We need people out there to talk about this and create the conversation so that people can be aware about postpartum depression and maternal mental health. So we need to create a lot of awareness. We need to train. He talked about a facility in Mombasa that is training community healthcare workers, people who are out there in the community, people who can access the homes and can be able to identify these conditions early and even link and refer the mothers early. And also now even linking the mental health space and the maternal health space,
Yes.
where we link the psychiatrists and the gynecologists and even the maternal health nurses, all the specialists in the maternal health space, to have a seamless interaction with the specialists in the mental health space, so that we don't have anywhere we are losing the mothers in the gaps.
Yeah, I love that. I mean, you've answered it fantastically.
Yeah.
Those are recommendations that,
Yeah.
as you've said, we should champion, because
Yes.
we are the people here on the ground
Yes.
interacting with the patients.
Yes.
So that's a challenge for us.
Yes.
Ben, I just want to thank you so much for being here today and for all the work that you're doing. It's too much. What he's doing is too much to fit into this interview. So I'd really like for you to follow him on his social media platforms. He's going to mention them, but we are also going to link them in the description below. So please follow him so that you can see beyond Mathari what else he's going to be doing about this advocacy on maternal mental health. So please tell the viewers where they can find you.
Thank you so much.
Yes.
So on social media, Ben Hagai on Facebook, Instagram, Strava, and then on X is Ben Hagai O. What am I missing?
Any publications or papers you've written, you've been part of?
Yeah, so if you go through those social media, how do you call it? I've almost shared each and every writing, publication in my social media spaces.
Fantastic.
So feel free to interact backwards as
Yes.
we engage, so that you see to what extent am I doing health promotion and health advocacy to be able to echo some of the voices when it comes to the space of health. Yeah.
Thank you so much. And please also subscribe to the Mathari National Hospital digital pages, so that you can keep getting to see these amazing conversations that we will be having. Thank you so much. Be sure to like, share, and subscribe. We'll see you next time.